My name is Josh Braddell. I'm a family nurse practitioner at the Wright Center and also serve as the medical director. I remember being off that day, knowing that the vaccines were being delivered, and then the kind of jubilation from a lot of people. Making phone calls to people that were off, myself included, and having everybody kind of run down and get vaccinated really quickly, and trying to get our family members vaccinated and those that were eligible. So there were always, some of our patients that were, even before the vaccines came out, that you knew that they were going to have issue with the vaccine and be hesitant to either receive the vaccine or not receive the vaccine at all. Of course, there had been a lot of conspiracy theories and confusing information for a lot of patients. So I think specifically what changes a lot, I don't want to say changes a lot of people's minds, but finally gets that patient comfortable enough to take that vaccine is just presenting up-to-date information on the vaccines, how effective that they are at minimizing hospitalization, and just that trust that you have to develop between the patient in trusting your decision making. Herd immunity, the best way to develop it is vaccination, and through immunizing the greater population. Herd immunity, the intention of that is really to protect those that can't be vaccinated, not so much those that don't want to be vaccinated. I tend to use my family as an example. I have 3 young children who were not eligible to get vaccinated for almost a year since the initial vaccines went out. And they had a father that worked in healthcare and saw patients with COVID every day. Once I was vaccinated, I felt a lot more comfortable coming home. It didn't have to change in the garage anymore, which was a good feeling. So I do say that to patients, and I try to use my story with COVID and COVID immunizations to help them understand the importance of it. I think the key is the trust that patients have between themselves and their providers, as well as the trust that we have in our patients to respect our opinions and develop that respectful relationship. Working on that trust with each other is really what gets you to that middle ground where maybe eventually they'll get vaccinated, or maybe you come to an agreement that maybe they'll receive that booster now, or and kind of overcoming that hesitancy. I primarily recommended the CDC's website. That's where most of our recommendations have been coming from. I really direct them to anything reputable. Not Reddit websites, Facebook, Twitter. That's not where they should be receiving information. Often what I ask patients when they present some sort of information to me is I ask them to look it up, and we'll look up the study together in the room, and that seemed to change a lot of patients' perceptions of the information that they were receiving.